All right. So I will copy. So you should start with presentation, yeah?
Yes.
Then видео в конце
Всё,
будете показывать?
оно в серединке будет, но оно включено в презентацию, он должен прочитать.
Okay.
We'll try.
Okay, let's go.
And to click.
Just a second. Право-влево, и можно по экрану показывать.
Щелкать. Это еще одна флешка. Ладно. Давлетова. Надея
So let me
Давлетова.
introduce Dr. Davletova with
Hello to everyone. I want to speak of ultrasound features in determination of the physiological volume of movements in the shoulder joint. It's a very important question for different specialization, for orthopedics, for surgeons, and of course for us, for radiologists. I have to tell you that we are using of joints ultrasound examinations and lack knowledge of shoulder joint ultrasonic anatomy lead a physician who is engaged in ultrasound diagnostics to erroneous conclusions. There are a few reports for ultrasound functional anatomy examination of a shoulder, so such situation needs refinement. Our purpose was to investigate the possibilities of ultrasonography in determination of a physiological range of motion in healthy shoulder joints. We also wanted to establish the points relative to volume of internal and external rotation, abduction and flexion. And we also wanted to determine the position of the probe during these functional tests. We investigated 30 patients aged from 20 to 25 years, 15 men and 15 women. They were our students of medical academy. They were examined and a direct projection. It was made to everyone to exclude the presence of bone pathology. After investigating both shoulder joints in every patient, we used static and dynamic tests, UCG dynamic tests. We used ultrasound scanner Voluson 730 Pro with using of linear probe with frequency from 6 till 12 megahertz. For determining physiological mobility in a shoulder joint, we used the following two techniques. We chose two reference points, the fixed point, less movable point, and movable point. The fixed, less movable point was on scapula, and the movable point was on shoulder. We measured the volume of active movements is such a motion. Look at me. It is for internal rotation. External rotation is when the patient is sitting like here. And speaking of abduction, such a motion, and flexion, such motion. I'll show it. In internal rotation, the coracoid process of scapular was chosen as a fixed point, and the long head of biceps tendon was chosen as a movable point. While external rotation, the coracoid process of scapular was chosen as a fixed point, and the medial margin of intertubercular sulcus was a movable point. And while studying abduction and flexion, acromion was a fixed reference point. A greater tubercle of humeral and supraspinatus tendon, which was attached to it, were chosen as a movable one. We see such places with the marking with red color on pictures. Next. So now you see photos of how we were making external and internal rotation with our patient. Transversely over the foresurface of shoulder at the angle of 90 degrees to the long axis of humerus. While abduction and flexion, the probe was parallel to the long axis of the humerus on the lateral surface of the shoulder joint, and in flexion it was posed on the foresurface. We have such indicators of the physiological range of motion in the shoulder joint. During maximum internal rotation, the tendon of the long head of the biceps was reaching or plunging under the coracoid process. In maximum external rotation, the inner margin of intertubercular sulcus was shifted outwards. In maximum internal rotation, the tendon of the long head of the biceps is reaching or plunging under the coracoid process. Let's see. Coracoid process, and now we'll see it with color. The coracoid process is in yellow. The inner margin of intertubercular sulcus is shifted outwards, and the tendon of subscapularis muscle was completely going out from under the coracoid process. I remind you that external rotation is with such a motion, and now we'll see how it looks like on video. External rotation. Now I'll show you such slide. And you'll see how supraspinatus tendon, it will be also with color in time. It is going from under the coracoid process. Supraspinatus is in blue color, and coracoid process is motion. And now I'll show how it looks like on ultrasound. And we see like the greater tuberosity with supraspinatus tendon is completely also plunging under acromion without any difficulty. And now I'll show you that motion. As you see, The physiological volume of active rotation, abduction and flexion in shoulder joint with using a functional UCG technique, which is based on displacement of movable point relative to a fixed one. Our results of our examinations is that UCG is one of the few methods which will allow us to evaluate not only morphology but also the function of shoulder joints. It's very important because, for example, MRI, it's a very good examination. It shows us anatomy, but when we're speaking of functions, it is very important to make some objectification, and the determination of the physiological volume with the using of UCG, it gives us a great opportunity for objectification of motion disturbances in shoulder joint, which occur in such diseases as adhesive capsulitis, impingement syndrome, and instability. Thank you very much.